Welcome, welcome to all our listeners out there. I am Dr. Tiffany Roberts, and this week we are highlighting some very important guests. These are amazing practitioners that have joined me in a collaborative book called The Way to Wholeness: Stories of Physical, Mental, and Emotional Healing. All right, and today I am joined by Dr. Courtney Davis. Dr. Davis lives in Tucson, Arizona. That is a beautiful place. I've been there once. She graduated from the University of Arizona in 2002 with a Bachelor's of Science in Biology and a minor in chemistry. She received her doctorate in chiropractic in 2007 from Northwestern Health Sciences University. And that is in Minneapolis, Minnesota. That's quite different than Arizona's weather. And Dr. Davis is a member of International Chiropractic Pediatric Association. I do love that association. She's received certification in the Webster technique and pregnancy and postpartum corrective exercise specialist. She also knows acupuncture, yoga, sound healing, and Dr. Davis is also certified in soft wave a technician. I might ask you about that here in a minute. And HOCAT technician, HOCATT.
The Hocket.
Hocket, okay, Hocket. And Dr. Davis holds specialty certifications in pediatrics and prenatal chiropractic. Along with practicing chiropractic, Dr. Davis is a certified childbirth educator, and she enjoys staying active outdoors and spending free time gardening and hiking. Dr. Davis has been serving Tucson since 2008 with over 70,000 chiropractic adjustments. Oh my gosh. Dr. Davis is featured in chapter 4 of The Way to Wholeness, releasing later this week. And I tell you what, you have many passions that I do as well. And I feel like you're living out my dream with the pediatric chiropractic and all of that. So for our readers and our listeners today, can you tell us a little bit about all of those qualifications and what they might mean? Because there's some people I know that don't really know what Webster technique is or HOCAT or things like that.
Yes. So the first one I'll talk about, since you mentioned it, is the Webster technique. And basically, it's a balancing technique to make sure that the uterus and the pelvis and everything is in the best possible position so that the baby can get in the healthiest position for birth, and so that mom can be healthy and comfortable through pregnancy as long as possible and have as healthy as a birth as possible. So that's basically the Webster technique in a small wrapped up little package there. Right. Some of the other ones on there, the Hocket technology is a new machine. I am a nerd and I love researching and finding new things. And for the longest time, I've been looking into oxygen therapy and the benefits that oxygen can have on our systems. And so I found the Hocket machine. It looks like this cool space capsule that you sit in. And it lets you have ozone therapy while you're sitting in it, as well as infrared therapy, carbonic acid therapy, PEMF therapy, essential oil therapy, color therapy, all going on at the same time in 30 minutes. And so it's just a really great way to easily do ozone therapy without having to have needles or IVs. So it makes it accessible to the average person to have have it be part of their regular wellness routine. So that's new and I'm super excited about it. We just got that machine the beginning of the year.
Wow.
So
I think I'm going to have to take a trip down to Arizona.
Yes, you should. Yeah. So I've been going in it once a week and it just helps my sleep and energy levels. And I feel an overall really good sense of calm afterwards. So
that's so cool. I'm looking forward to understanding more about that because I'm a nerd as well. And I like all the things, and especially when it's got all the different things, the color therapy, essential oils. I really love essential oils.
Me
So
too.
doing all of that sounds amazing. Yeah.
Yes.
So can you tell us what really brought you into, the chiropractic world and everything that you offer, but more specifically, what really brought you into pediatric?
Well, in the book, I share in my chapter about as a child, I always felt sick. I always had some sort of kind of stomach upset. I just never felt really perfect or well or whole in my own body. And I just always had this underlying feeling that I was meant for more and to feel better, and that God had a plan for me to be healthier some way. And so that was kind of planted in me early on. And so I just have been, without even knowing it, kind of searching for that since I was little, trying to figure that out. And as each health challenge I've come across in life, I kind of try to see that as a gift of an opportunity for me to learn from that and use it for good, and to try to help teach others so that they don't have to go through that or suffer through that as long. Because there's a lot of things out there that I feel like there's answers to, that people aren't talking about or sharing. And a lot of people feel like it's normal to suffer through life, and life is supposed to be painful, and it's supposed to be a suffering experience. And I felt that really prevalent, particularly with pregnancy. I feel like we're told like, yeah, pregnancy is going to be kind of crappy, and just know that that's what it's going to be like, and just deal with it. And there's so much support that we can give and get during pregnancy. And there's a lot of pain that happens that's not necessary, particularly if you can be your body supported with chiropractic through your pregnancy. Good nutrition, rest, good mindset, all of those things can make a huge difference. And so I just want women to know that there's support and there's help out there, and not to just know they have to sit at home dealing with whatever's happening. So
Right, because I remember when I was pregnant with Aria, I was going through chiropractic school, and thankfully I had years of chiropractic knowledge, and really that really saved me because I had lower back issues and balance issues because I'm this short 5'2" and my belly is like about 5'2". So and going through the Webster technique, that really did help. And being able to find a chiropractor that could support a gentle chiropractic adjustment during that time is very crucial and very helpful. So I'm saying, if you girls are pregnant out there, definitely go to Dr. Davis, because these techniques are really truly life-changing during that time. Because if you're in pain, you're not really feeling well, and neither is the baby. Because if your mindset is that you're always in pain, the baby is going to feel that vibration off of you. Can you tell us a little bit about what is soft wave technique?
So soft wave technology, so glad we found it. It's really awesome. When I came across it, when I was researching, I realized that was kind of the machine I wish that was around and that I knew about when I was a gymnast. It's super great for acute injuries, sports injuries, really good for joints, knees, shoulders, those types of things. But it uses light and sound. It's actually the same technology of lithotripsy, which is the technology that's used when they break up kidney stones. So it's those shock waves, those sound waves. And so it looks like an ultrasound head. And what's so awesome about it is we basically run it over the joint. And because it sends in that strong shock wave, where there's damaged soft tissue, it'll cause a sharp, like tooth ice pick pain. And so it helps us to locate exactly where that damaged soft tissue is. And then we sit there and we treat the area with the shock waves and the sound waves and the light waves. And what that does is it causes the cells to believe they've been through a major trauma. So then the cells start a major healing cascade, and they recruit the stem cells from your body to that area. So it's a way that we can do stem cell therapy without injections,
Oh, that's
or
amazing.
harvesting or using other people's tissue. So it's helping your own body. It's like saying help is needed here, send all your resources, and it sends your body's own stem cells to the area. So
Wow.
we've seen awesome results, particularly knees, shoulders, joints that get a lot of wear and tear, tendonitis. I was able to heal a tendonitis in my shoulder with it, which was wonderful because I had tried everything. So it's a
Yeah.
really fun tool to have in practice when people think all that's left is cortisone shots or surgery. It's a really
Right.
good option that we can try first.
Oh, that is so amazing. That sounds awesome too. Tell us a little bit about your childhood. You said that you were a gymnast, and reading your chapter, I'm telling you, like, you totally gave me the heartstrings. Can you tell us a little bit about what you went through and your journey?
Sure. So I started gymnastics probably when I was about 6 years old. And I loved it so much. And looking back, I realized I feel really good in my body when it's moving. Like
Mhm.
that does really well for me. And so I was really hooked on it. And I lived in the gym, and I was in the gym like a part-time job. So at
Yeah.
least 15 hours a week, I was at the gym training and practicing and competing from a pretty early age on. And I did really well until I started hitting my teenage years. As far as injuries, I was pretty injury free. And then when I started hitting my teenage years, I developed that Osgood-Schlatter syndrome, which is as your growth plates and your tendons and everything's growing really fast. The way my tendon grew, it grew in a different way. So as I used my knee and my leg a lot, it basically chipped away pieces of the bone in my kneecap. So it's very painful. And I was basically told, oh, there's nothing you can do. And it was so painful that I really couldn't keep up my training and able to keep competing. So I basically just had to quit. But I was never told, hey, try PT, try going to a chiropractor, try this stretch. Like it was literally
Right.
like, sorry, like this is what you were dealt with in life and good luck. So
Ah, yeah, my sister had Osgood Slaughter as well, and she loved volleyball very much. And she just had to stop because
mhm.
back then they didn't know anything that was possible. It was just like, well, you got the short end of the stick, I guess. But unfortunately, that's how it worked. But today there's different things that we can do.
Yes.
Um, so in your practice, what is something like major that you see a lot of, not major, but a lot of things that you see in reoccurring in different patients?
Well, I do work a lot with pregnant mamas. So I definitely see a lot of moms who come in with pubic pain and pelvic pain. A lot of them mention it hurts for them to turn over in bed, or some of them it's so severe they can barely walk.
Yeah.
So I do a lot of work with that, which is super rewarding because when you can go from being able to not turn over in bed and barely walking to feeling good again, um, it's amazing. So
Yeah.
that's really fun to deal with. I also work with a lot of kids, a lot of babies with torticollis or trouble feeding or nursing, or they're just maybe colicky or upset and their nerve systems are just pretty wound up and they need that support to help calm their nerve system down so they can eat, sleep, and poop better.
Right.
I always tell my mamas, they're like, well, what does chiropractic help babies with? And I said, if they have trouble eating, sleeping, or pooping, bring them in because it helps support the nervous system be able to do all those things. So
Absolutely.
that's another big one, but we do see people in all ages, people who are looking for better mobility, better quality of life, better sleep, better performance in their ability to work out or be active. Those are really some of the big ones, but also people come in looking for guidance with nutrition, how to eat healthy, how to have healthy weight, that type of thing. Um, those are really probably the biggest things other than what we talked about with the soft wave machine and the joint
Mhm.
injuries.
Okay, very
Yeah.
good. So, through all of your gymnastics as a child, and then having to end it because of the Osgood slaughter, what different things did you do on your healing journey to try to help yourself? Because I know you said you had a lot of stomach issues, and obviously, your knee pain. What are some things that you did on your healing journey?
Well, not much until later college years. Late high school, college was when I had my first visit to the chiropractor. So that's the first time I had ever even been to some type of body work or body care. So that was my first start, was adding chiropractic. And then as going through that, again, I just felt like, oh, there's something else, there's something more, there's something missing. And then added acupuncture later after that. Lots of work with trying to do nutrition and food elimination. I found the remedy testing super helpful, which is a hair analysis test that gives you foods to cut out, those types of things, but it also gives you emotional stuck points and things like that to work through. I've definitely found that the emotions are a big part. The older I get, when I get stuck in a health rut, I realize eventually, okay, there's an emotion that's behind this or underlying, and eventually found the HMT through that. And definitely found the soft wave.
Yeah.
Essential oils, huge blessing with essential oils. Have used those for a really long time.
And people don't understand really the true benefits of essential oils. It's not just something that smells good. Okay.
No.
It goes much deeper. It goes into, it can actually help you with emotions. It's very spiritual. I know all of the spiritual parts of it. It's medicinal. It's natural. I mean, the list can go on and on about how powerful essential oils really are. And once you understand that in a clinical practice, your world is completely different. It's not just what is that? What am I trying to say? A marketing scheme. It really truly benefits you if you know how to use it in the proper way.
Totally. I
Yeah.
feel like adding essential oils was a big part of me,
Yep.
helping me to kind of take toxins out as well. Getting rid of candles and perfumes
Yep.
and those types
Oh,
of things, and using essential oils in place of a lot of those care products.
yes, absolutely. And a lot of people don't understand that even just your dryer sheets are extremely toxic for you. And if you just simply use a wool ball with essential oils on it, there's no toxins. It doesn't, it's called gassing, and they release scents, even in your closets after it's already been through the dryer. And that's very toxic, especially if you're wearing it, if your baby's snuggled up against it, it's a major cancer causer.
Mhm.
So yeah, I'm very happy that you are using that in your practice. It's such an amazing tool, along with everything else that you're doing.
Thank you.
What would you like for our readers and our listeners to take away from reading your chapter and just in today's conversation?
The biggest thing that's coming to my mind right now is giving our bodies some grace. I feel like we kind of look at them sometimes as like the enemy. And we
Yeah.
kind of talk about how, oh, my body is not showing up for me today. Or I hear all the time, well, this is my bad knee, or this is my bad shoulder. And it's just being aware of how we talk to ourselves and our bodies, and really just trying to make a mindset where we wake up every day that we're thankful about how our body showed up for us that day, and all the things that it is capable of, and all the millions of processes and things that it's doing every second to keep us alive. And just really listening to what our bodies have to tell us. I think we're so trained to, just push it down and not listen and move on with the day. And I just want everyone to know that our bodies really are there for us, but we have to be nice to them and listen to them, and then they'll show up. So.
Right. Yes, that is such an amazing message. Absolutely. And our bodies are really miraculous. Like you just said, that we go through so many things all day long to keep us alive that we're not even really consciously aware of. I don't sit here and think, okay, I got to take a breath. Okay, take my heartbeat. I got to breathe, right? It's already working, but the signal that we're sending to our body, like you said, wake up with gratefulness and how it actually did show up today. And that completely transforms um, a lot of ailments and how you're going to be able to perceive that day. And if something does come into your day that's not really ideal, if you wake up with the gratitude, you can deal with that situation a lot better. Have you been able to work with HMT with any of your clients?
Yes.
And how do you incorporate that into your chiropractic practice?
Usually a phone consultation.
Mhm,
So it's new. And so I don't,
mhm,
for me, it's new practicing it. So it's not something I necessarily invite everyone to
mhm,
participate in. But when I do, we do a phone consultation.
mhm.
And I feel that the thing I just mentioned is what so far is just really helping people to connect into their own bodies and to be more thankful and aware of what they really are doing and capable of as far as healing goes.
Yes, absolutely. If our listeners want to reach out to you, how do they find you and how do they connect with you?
Yeah, so the best way, I definitely have Facebook and Instagram and all of those things. My practice name is Resiliency Wellness Center, so I can be found there. But also my email, Dr. Courtney Davis at gmail.com, or even my website, which is
Okay.
drcourtneydavis.com. Those
Okay,
would all be
great.
great ways.
Perfect. Yeah, and I will add all of that information in the links below so they can have easy access to all of your information. Do you
Thank you.
have anything else that you want to add for our listeners?
Just thanking you for letting me be part of this journey with you. It's been really fun and I appreciate you.
Yes, thank you. I really appreciate you and like I said, everything that you do is like my heart center because I really love working with women and children. And when I was in chiropractic, I didn't finish it, but when I was in chiropractic, I really wanted to focus towards the pediatric side of that. So you're living out my dream.
Come visit
I
anytime.
will. I'm going to have to do that. All right. Well, thank you, Courtney, for joining us today. And be sure to check out her chapter. It is chapter 4 in our book called The Way to Wholeness, releasing later this week.